Hmm. Hypertension and COVID. What's the connection? What do they have in common? Let me think about this. So hypertension, let's see, 90% of us will develop hypertension in Canada. COVID, only about 5% of Canadians have had COVID so far. They both can be asymptomatic. They both can kill. Um, and this sounds very interesting. Emma, what are we talking about?
Yeah, so today, welcome to our first actual General Health and Hypertension Club's webinar. We're really excited to be here, and this is just a quick introduction to our team. We actually put out one video already that is an animated video about 3 minutes long on hypertension, so we encourage you to watch it. And today we're really just delving into, hypertension as well as within the context of COVID. So I'm just going to start us off with, the basics of a hypertension, explaining what blood pressure is and how it relates to everything. All right. So in terms of the basics of blood pressure is just a force, the force of your blood that's pushing on your blood vessels. And so your blood pressure is not one value that stays constant for the rest of your life or for the rest of the day even. It's going to be changing throughout the day as well. It's going to fluctuate, depending if you're feeling really stressed out, if you're feeling a lot of emotions, or you're exercising. And so actually from one of our previous hypertension webinars, we also mentioned that if you take any stimulants like nicotine or, if you smoke, that will also raise your blood pressure. Generally, if you're, measuring your blood pressure, you're going to see
Backtrack one slide again. Hold
Yeah,
on for a
for
second.
sure.
This is kind of interesting here. So this blood pressure, it's a force it's a force of of the blood vessels pumping. Um, so you know, people say, you know what, my blood pressure is never the same. It changes and it goes up to 200 and it goes down to 90. Is that when do we get concerned? Do you have any thoughts about that?
Yeah, I think like something we're going to touch on a lot deeper is really like how is your blood pressure throughout the day in general, and how is it over long term? Like, do you feel as though, in the past month, in the past 6 months, there's been an increase overall to it? Do you feel any symptoms along with it? Oops, sorry, that's my dog in the background. Um, so
Excellent.
we'll
So, you
touch
know,
on a
what
little bit deeper.
to remember is that blood pressure should change. And if your blood sugar stays the same, either you're not doing it properly or you're dead. So it should go up and down. So when the blood pressure goes up to 200 during moments of excitement, that's okay. If it goes down to 90, that's okay too. Don't forget, these machines make mistakes as well. They're not perfect. You get extra heartbeats in there, the machine has trouble. And what the message should come loud and clear is the burden of high blood pressure or your blood pressure burden over a lifetime that's important. So we moved away from what's a good cholesterol to bad cholesterol to what is the burden of lousy cholesterol over a lifetime. It's the same thing with blood pressure as well. These are things that can change. Blood pressure is damaged vessels, so it's a long-term effect. Like it's the weather. You know, the more rain you have, the more sun you have. It's that environment that's important. So I want people to walk away with is that most of us, 90% of us, will develop high blood pressure in Canada if we're not careful, and that you need to have your own blood pressure machine today for the rest of your life. It's not the Shoppers Drug Mart, it's not the farmers, it's the doctors. It's your blood pressure machine that you should learn how to use and take pride in that. Everybody should have a scale, a blood pressure machine. These are things that are necessities of good health, and blood pressure should fluctuate, and you need to record it. And then when you see your physicians, your healthcare provider, you can share that. So don't be alarmed by the isolated ups and downs. It's a burden of blood pressure over a lifetime. So when to call if I'm passing out, I'm feeling dizzy, my blood pressure is, let's say, less than 100, or my blood pressure is consistently over 140 to 150 range, then call for an appointment. Perfect. Go there, Doctor. Oh, by the way, this is Dr. Emma to be. Emma's been with us for a number of years. I'm so pleased and so honored that she's going to be starting medical school in Ottawa this fall. And Emma, congratulations. Yes.
Thank you very much. Yeah, definitely learned a lot from the clinic. So this is a great experience for, I know, a lot of newcomers here. So yeah, thank you. And we'll move on to the next slide now. Just a little bit more about the blood pressure. We go over this in the quick animation as well. But basically the top number that you'll see, the 120, or like represented by the 120 over here, is what is known as the systolic blood pressure value. And so that's basically the blood pressure when your heart is in contraction. So when it's like, pumping the blood around the body. The lower value, which is represented by the 80 at the bottom right corner over here, it's known as the diastolic one. And that's just the pressure when the heart is like relaxing. And so generally, like Dr. Kearney says, it varies between people. We consider, 120 over 80 healthy. If you can get it lower, like, the 110 to 120 range over 70 to 80, even better. And that is dependent on a whole bunch of things, but there are a lot of things we'll talk about later on that you can do to make your blood pressure healthier. And so something that's really interesting, this is a study that Dr. Kearney saw, and, it has really great information. It's a meta-analysis. And so we know from a meta-analysis, it's considered to be one of the highest levels of evidence. So it's like a really great study because it takes all of the existing data and studies that they can find to determine one shared effect. And what happens is that some of the bias that may come up in certain studies that, have a little number of people, or maybe you think their methodology is a little iffy, the meta-analysis really pulls everything together, so hopefully reducing or counteracting some of those biases, and can present one full conclusion based on thousands of patient data. So in this specific meta-analysis, they took over 100 studies with over 600,000 patients, so a huge sample size. And what they found was that if you have a 10 millimeter of mercury reduction in the top value, so the systolic blood pressure value, you have all of these fantastic reductions in all of these risks. So for example, you have 10 millimeters reduction in systolic value, you'll have 20% reduction in the risk of major cardiovascular disease events, 17% for coronary artery disease, decrease in 27 for stroke, decrease in 28 for heart failure, and decrease in 13% for all-cause mortality. So this is like, if you can decrease it by 10%, you're giving yourself that much of a better chance to not have any of these events happen to you.
So it's time for everybody should pause when to look at this. So what I would do is take a picture of this, put this in your brain, show it to everybody that you know, that you like. If you don't like that person, then don't show them this information. But this is actually a meta-analysis of 600,000 patients in something called randomized controlled trials. So this is the highest quality of evidence, 600,000 individuals. And it shows that, so you mentioned, Emma, that the best blood pressure is somewhere between 110 to 120 systolic range. You're going to learn, we call hypertension 140 over 90. For sure, everybody should get treated. But this trial actually, this data shows that getting blood pressure down to 110 systolic range, if you can do it safely, shows benefit. And for every 10 millimeters reduction in blood pressure, so if I go from 140 down to 130, I can decrease mortality by 10%, heart disease by 20%, stroke by 30%, congestive heart failure by 30%. So if you start off at 170, you go to 140, you triple that effect. So this is actually very, very important. So we can decide how low to go, and that's very much an individual decision. So the point that we need to make is that you can get so much protection from congestive heart failure, from heart attacks, from strokes, from myocardial infarction. And this also will translate to reduction in Alzheimer's disease. And also what we don't have on this slide is kidney protection. Everybody's always looking at their kidneys, and one of the biggest predictors of how long your kidneys are going to last for is blood pressure. So that's actually important. So when I hear this, my blood pressure is good, well, is it always good? Measure, keep track of this information. So this is actually a key important bits of information. Now, if you backtrack one more slide, under blood pressure, you put 120 over 80, which is fine. We're missing one variable, and that's heart rate. Because blood pressure is the systolic and the diastolic we're going to learn about, but how many times a beat per minute. So record your heart rate, because that's actually very important. So if you can just move forwards there, Stuart, and these are key information. So I love this slide. It's very important. And the question is how low to go, and that's very much an individual decision. And we'll learn more about that. Go ahead there, Emma. Next slide, please.
Yeah, for sure. And so we thought it would be a good time to have a little bit of a pop quiz. I think Dr. Kearney alluded to the answer previously, but our question to everyone who's listening is, what is the best way to measure your blood pressure? Do you think it's A, at home with your personal blood pressure machine? Is it B, with a 24-hour blood pressure machine? Or is it C, in the doctor slash, your pharmacy's office?
Does anybody have an opinion on that? I'm going to say it depends. If you measure your blood pressure lousy, intermittently, not reliable, then home blood pressure doesn't make sense. So if you come to the doctor's office and people are rushing around, and which is often the case, under stress, what that doctor is going to say, how long I'm going to wait for that, brings up your blood pressure, or go to the dentist, that can be a lousy measurement as well. The 24-hour blood pressure machine, really a daytime average, is a wonderful predictor, but it's just done once, and it's a burden of blood pressure. So my best answer is it is the home blood pressure that's done properly on a regular and repetitive basis should be the best predictor and is the best predictor of what's going to happen to you and the burden of blood pressure. And so when people say my blood pressure is good, or I've done it at the pharmacy, at the doctor's office, you're messing up. You're missing out on such important benefits. So really, I really encourage people is that a blood pressure machine is anywhere between about $50 to $200, depending on the model that you get. You want it approved by Hypertension Canada, get a proper blood pressure machine. It's one of the best investments you can make in your health.
Yeah, and so this is actually maybe Dr. Kearney, if you want to touch on this slide, and Helen, who's in the office, I believe, with blood pressure records.
So Helen is a wonderful lady. She was here today. She wants royalties on all the for everything that we do, and perfect. But look at this. She records her blood pressure. She brings it in. She does it properly. We know where we stand. And you can see, if you look at this category, blood pressure is different. The doctor's office blood pressure is always higher by about 10 millimeters. The ambulatory blood pressure machine, which you wear periodically, which is a wonderful thing, is that you want a daytime awake blood pressure less than 135 or 85, and it should fall at nighttime. And we think a home blood pressure should be less than 135 or 85, or even lower. I would rather have a blood pressure of 110 to 120 systolic range. It doesn't mean you're going to go on medications to achieve that level, but you can certainly improve it with lifestyle changes and medications when necessary. So this is actually the constellation of multiple blood pressure readings at the doctor's office, at the pharmacy, in your home, and at the doctor's office. Helps you in your journey looking at the burden of your blood pressure over a lifetime. So that's the way I would look at this over here. And again, very key slide, very important information. And the key is that you are in control of your blood pressure diary. You're in control of your how much stroke, heart attack, congestive heart failure, dementia you have by simply monitoring your blood pressure and doing something about it. Wonderful, thank you.
And so I know we talk a lot about, the importance of measuring it. And I think something really important to point out is the idea of what if you're someone with hypertension, but you're just asymptomatic? So similar with COVID, right? People can have both COVID or they can have hypertension for a long while and not even realize they have it. And so, of course, the danger with that COVID, you can transmit it to other people. With hypertension, like Dr. Kearney said, it's the burden over a lifetime. You really want to keep that burden as small as possible. So you're opening up yourself to so many other risks if you don't know. So with COVID, there's testing, and with your hypertension, there's also testing in the form of your blood pressure machine. So it's really recommended that you have ways to check your vitals at home. So that's both with a scale as well as a blood pressure machine. And what if something else happens in the future, perhaps during flu season, if there's another COVID that happens, hopefully not. It's really important to have one that you can monitor, or have a blood pressure machine that you can use and that you can monitor regularly. And so generally, we do talk about this in our other webinar. In terms of taking your blood pressure, try not to exercise, drink, smoke before taking measurements. Stay relaxed during the actual measurements and take at least 3 with about a minute to 2 in between for breaks. And if you are feeling, symptoms of dizziness, if you may be almost faint, if you're feeling any of these symptoms that may make you think you have hypertension, try taking your blood pressure in different positions. So, try it lying down, try it sitting down, try it standing up even. Anything else to add, Dr. Kuhn, to this slide?
I think it's really important. People say, I'm having a side effect from my blood pressure medications. Well, guess what? Measure your blood pressure. If you get dizzy when you stand up, measure your blood pressure standing up. I just measured my blood pressure using a device called Anura. I don't know how accurate it is. My blood pressure right now is 124/76. Yeah, I just had, I'm drinking hot coffee. I'm talking to people. I'm not relaxed. This is not the way to measure blood pressure. And I'm kind of surprised it's that good under these circumstances. And that's, and so it's also important to do the right thing. So really, if you think, and it's really kind of important, is that, we get dizzy, we move around, so get up slowly. But I would do this. If you get dizzy, I would do my blood pressure sitting or lying, do 3 readings, then sit up, do it again 3 times, then stand up at a minute and 3 minutes later, and just measure your blood pressure, and just to see if it's changing over time, because that really is important to look at that, because if you get dizzy and your blood pressure is falling over 10 millimeters of mercury, we may have to change your therapy. And if we don't measure, we don't know what to do. And so that's actually kind of an important thing to do that. So so many things you can look at that effect over time. Thank you for sharing that.
And so we'll just go into the exact definition of hypertension. Hypertension is really considered, like when Dr. Kearney said, when your systolic pressure is over 140 and your diastolic one is above 90. So if your blood pressure is over 140 over 90, that's really when the doctors are going to be working with you to see what they can do. In terms of hypertension, we can further split that into 2 categories. There's the primary type, where there's no necessarily identifiable cause, likely developed over many years due to some existing risk factors. On the other hand, secondary hypertension, if you have a pre-existing health problem, such as kidney disease, stroke, or atherosclerosis, and you develop hypertension secondary to that, that's secondary hypertension. And so we'll go into risk factors later on, but just some general ones, obesity, age, ethnicity, sex, tobacco, alcohol, and stress. And so,
So there's no debate that if your blood pressure is greater than 140 over 90, it's too high. The debate is, if my blood pressure, should we go lower than that? Because what you showed, Emma, going from 140 down to 130 translates to 20% reduction of heart attacks, 30% reduction in strokes and congestive heart failure. So if you're at high risk for those disease processes, getting to 130 may not be unreasonable, and maybe even lower, but that's really a very much individual decision, and there's still controversy on how low to go. There always was controversy about cholesterol until a few years ago. Lower for cholesterol has always been better, and probably lower for blood pressure, provided we're not making you sick from dizzy or passing out, may be a better thing too, especially if you already have damage to kidneys, you have diabetes. So people who have kidney problems, who have heart disease, I'm often trying, if I can, to get to a systolic of 130 or less. That's in the doctor's office. At home, that would be 5 or 10 millimeters lower. Remember, we said that 130 in the doctor's office is probably around 125 to 120 at home, because blood pressure is usually 5 to 10 millimeters higher in the doctor's office compared to home when you're measuring in a proper format. And that's why it's good to have different readings of different blood pressures. So go ahead there, Dr. Emma.
Yeah. So in terms of the signs and symptoms of hypertension, so unfortunately, there's no unique clinical presentations or signs or symptoms that are only due to hypertension. And so really the only way you can do it is just by measuring it and keeping track of your blood pressure and just making sure you're actually taking them correctly. So some general symptoms that could indicate include shortness of breath, headaches, nosebleed. So as you can tell, they're quite general, and you get these maybe on any given day a few times, but they might not be even related to hypertension at all. So really, again, just make sure that you measure consistently.
So Emma, what's the most common symptom of hypertension?
I would say dizziness. Is that right?
Absolutely nothing. You're asymptomatic. You don't know. So most people who have hypertension don't know. It's a silent killer. And that's it. So if you're gonna wait till you get sick, and one of my patients said something to me, is that healthcare we deal with illness. Why not deal better in prevention? So this is actually a step how you can prevent illness, and this is actually really something to think about. So thanks for sharing that. Next slide.
And so, like Dr. Kern, you mentioned, about 90% of Canadians, so that's, 9 out of every 10 people, I would say that's maybe everyone or the majority of people in this meeting right now are likely going to develop hypertension eventually. And so, like you see over here in the blue box, these are some of the long-term consequences. Myocardial infarctions, heart attacks, heart failure, stroke, kidney disease, dementia, peripheral artery disease. So not to scare you, but this is something that's really important that you deal with right now, and just making sure that you keep track of your blood pressure and just really driving point that home of have your blood pressure machine and continuously measure it. And at the top right corner, like Dr. Kern, you mentioned, it's really important about the burden of how long you have high blood pressure over a lifetime.
It's also interesting. What we have to add to this list is COVID-19. If you have hypertension and COVID-19, you're more likely to die, more likely to be hospitalized. And that's probably true for all infections as well. So, influenza, which is a sister of COVID, is that having influenza, we know that people in influenza season, which was gone this year because of all the good hygienic measures, after having influenza, you have more heart attacks. Same thing with COVID as well. So if you want to stay healthy, get your blood pressure down and learn how to control it better.
And so in terms of some interventions, we do go into a lot of detail in our previous hypertension webinar. But basically, there's a lot of lifestyle changes that you can see in the left-hand side. And on the right-hand side, these are some of the medications that you might take. And this would be a conversation that you have with your doctor. But we would really like to stress, take a look at our old webinar. They have a lot of great information on how to manage hypertension in like actionable items that you can take in order to make sure that your hypertension or your blood pressure in general is on the lower end.
It's like a question for Stuart. Stuart, is that you have high blood pressure, you're taking your pill. Are you good?
No. I mean, that's probably, medical intervention or even medications. I know it sort of gets a reputation that, you want to do things naturally, but medications are, of course, important, especially in managing cholesterol and hypertension, but it's not everything. Diet and lifestyle interventions, exercise, mindfulness, those are all crucial. You need the whole meal. Really, right now, you're just getting an appetizer with medications.
And so how many pills do you think you need to control your blood pressure? What do you think? What is the average? Is one pill enough to control most people's blood pressure?
Usually not. We see a combination at the clinic of beta blockers, ARBs, ACE inhibitors. There's many different medications that target different modalities in the body, but oftentimes take different medications to manage it, and the same medication won't work for. It might work for you, but it might not work for your sister or your mother, for example. So different things work for different people, but very oftentimes you need a whole team on your side when it comes to medications. So oftentimes one is not enough.
Yeah. So the mistake is that one pill doesn't solve the problem. Most people require 2 to 4 medications to control their blood pressure or better lifestyle changes. In fact, each lifestyle changes is half as good as the medication. So we're going to talk about the lifestyle changes that are important. So you need multiple lifestyle changes and probably multiple medications for many people. But, is that if you get your weight down, you're not drinking alcohol, you're watching your salt, you're on a DASH diet, your meditation, your relaxation, you can actually get 20 millimeters of blood pressure lowering. Well, each blood pressure medication will give you about 5 to 10 millimeters of mercury. So you can see that you mix and match. It's sort of like, I hate to say this, the Toronto Maple Leafs. There's always next year. You're always getting better. And I think the Toronto Maple Leafs are pretty close. So I hope they don't change too much of that team. They have a core group of people who just get better. Maybe they just need to measure their blood pressure a little bit more often.
Exactly. And yeah, that brings us to the key takeaways for this first section. Measure your blood pressure at home frequently and measure it well. And a 10 millimeter reduction in your systolic value brings along a lot of risk reductions. So really great things for your future health. And hypertension is treatable by working with your healthcare team, as well as taking, personal changes, lifestyle changes. Any last comments or any thoughts about this section?
Yeah, it's sort of like a flat tire. You know when your tire is flat, it's too late. You blow your tire. And same thing with blood pressure. It's asymptomatic. 9 out of 10 Canadians are likely to get it unless you make the lifestyle changes that are important. So my plea to everybody is get a blood pressure machine, get an approved blood pressure machine, use it properly, and use it often. And write down the results, and we'll decide together what the best approach is for you.
And before we maybe move on to the next section, while we're on the topic of measuring your blood pressure, we had a good question that I wanted to get Dr. Kearney's opinion on. So somebody on YouTube asked us, and I'll say the exact way that they wrote it, what's the relationship between blood pressure and pulse rate when the blood pressure is low, but your pulse rate at rest is high?
So we have two factors. So is that heart rate and so the amount of blood that's ejected by your body is dependent on the stroke volume and the heart rate. And so blood pressure will influence that. So the amount of blood that your body will pump around. So they're both very important variables. And obviously, if your heart rate goes very low, the body has to compensate by pumping out more blood. So there's a very good relationship. And basically is that I want to know what your heart rate is in different disease processes. If you have congestive heart failure, you want your resting heart rate to be around 80. If you have atrial fibrillation, if you have congestive heart failure, I want your resting heart rate to be close to 60. If you have atrial fibrillation, maybe a little bit higher at 80 because you don't have the atrial contribution. And so as we get older, our heart rate tends to slow. And if you're an athlete, you have a very slow heartbeat. So, you see a lot of these super athletes that beat around 40 beats per minute. Most of us somewhere between 60 to 80 beats per minute is sort of like the average, but it is variable. So no simple answer, but one of the things I see all the time when people will say with their blood pressure is they forget the pulse. And that's the third variable, and we'll put that part of the equation. So I feel like a politician on that one. I didn't fully answer it as well as I could because it's complicated, and we need to look at other variables to part of that equation. It also tells me what medications to use. If your heart rate is very fast, I want to slow it down. And if it's slow, I don't want to make it too slow. And the medications are important. And depending on how fit you are too as well, will help determine what the next step should be. So measure your pulse as part of your blood pressure.
Right. So that brings us to the next section. I'll hand it off to my teammates to talk about risk factors.
So now that we have a general understanding about hypertension, we thought it would be useful to cover the various risk factors and how you can best manage them to improve your overall health. So first, to clarify the difference between a symptom and a risk factor, one can think of a symptom as a physical or mental feature which is seen to indicate having a condition or disease. For hypertension, symptoms develop over time and often aren't clear. On the other hand, a risk factor is something that increases a person's chances of developing a disease. It does not mean that if you fit the following criteria, you will develop hypertension, just that you are more prone and susceptible to do so in comparison to others. Today, we will be going over some of the major risk factors and have divided them into two major categories, non-modifiable and modifiable. So it's important to remember as we go through these factors that they're all interconnected, and even non-modifiable factors can still be modified indirectly, as will be discussed on the following slides. So if we want to move on to the next slide. To start off with the non-modifiable risk factors, we can first begin with age. So in general, the risk of high blood pressure and consequently hypertension increases as you age. And this increase in blood pressure is mostly associated with structural changes in your arteries, particularly with the development of large artery stiffness. So what is large artery stiffness? It indicates either of two major terms, arteriosclerosis and atheromatosis. And these are often combined to form atherosclerosis. So what are these terms? Sorry about that. Arteriosclerosis, in particular, is a generalized thickening and stiffening of the arterial wall, and this is seen on the right of this image. On the other hand, atherosclerosis is the buildup of plaque, otherwise known as fatty deposits made up of cholesterol, fatty substances, and other cellular waste products in your arteries, and this is seen on the left of this image. In both these conditions, there is a narrowing of the passage blood can flow through, which leads to an increased blood pressure, and this can result in the development of hypertension. So if we want to move on to the next slide, yeah. It is partly for this reason that isolated systolic hypertension, which is an elevation in systolic but not diastolic pressure, is the most prevalent type of hypertension in those aged 50 or over. And it can develop anew or the development after a long period of systolic diastolic hypertension with or without treatment. So what exactly can you do? The term non-modifiable is used very loosely here. In general, as one ages, a reduction in exercise, increase in stress, changes to diet, etc. may all occur. And all these factors are things that you can control. So what is the big takeaway? Though blood pressure and resultantly the development of hypertension seems to increase with age, it may be the changes in your lifestyle that point toward this trend. And making better and healthier lifestyle choices, such as a healthier diet to prevent the buildup of fatty deposits in your arteries, could help decrease this risk in the long run. So another common non-modifiable risk is ethnicity. And in general, those identifying as belonging to a racial or ethnic minority have been seen to have a higher risk of both contracting hypertension and also passing away from hypertensive-associated cardiovascular diseases. And high blood pressure is particularly common among those of African heritage, and this is seen to develop at an earlier age as well. Serious complications such as stroke, heart attack, and kidney failure are all also common in people of African heritage. So while ethnicity also falls under the category of non-modifiable risk factors, one should be wary of classifying it as such. It has been suggested that due to a lack of genomics providing no clinically useful application, addressing the social determinants of health and hypertension disparities can be more useful. And by this, it means addressing the gaps in education, access to healthcare, income, etc., as it is believed that the varying prevalence of hypertension in various ethnic groups is influenced more heavily by differences in social factors than genetics.
So in addition to age and ethnicity, gender is another non-modifiable risk factor for hypertension. So in general, male display a greater risk than female pre-menopause, while after menopause, females' blood pressure tend to rise to a level above or similar of that of men of the same age. However, with regards to age, like we already talked about, the older one gets, the greater the greater risk they are at developing hypertension, irrespective of their gender. So this is explained by both biological and social differences. So first, considering the work conditions and the general environment that male are usually exposed to, they are more likely to develop habits that contribute to hypertension, such as smoking, drinking, irregular sleep patterns, etc. And we will discuss more of these factors in detail soon. It has also been evident that male are generally less aware of the symptoms and risk factors for hypertension. Thus, they're not able to identify the severity of these symptoms with regards to developing hypertension, therefore putting them at a higher risk. And lastly, biologically, there are genetic and hormonal differences between male and female that contribute to developing hypertension, making this factor mostly non-modifiable. Family history would also play a role in increasing the chance of developing hypertension, as it is a biologically heritable trait. So individuals whose parents have hypertension have an increased risk of developing this condition. This is particularly true for individuals where both of their parents are affected. However, again, it's not always just the biological component. Like socially, these individuals will end up sharing a similar environment as their family, and the decisions that they make will likely be influenced by their family. Hence, they may end up living similar lifestyles as their parents and practicing some of the similar unhealthy habits, which further increases the risk of developing hypertension. So, risk factors such as age, ethnicity, gender, family history are all considered to be non modifiable factors because we likely can't just actively and directly control them with our behavior. However, we will now go on to examining some of the modifiable factors and how they increase hypertension, as well as how we can take control physically and pharmacologically.
So, obesity is an imbalance between energy intake and energy expenditure, and is most often recognized as having a BMI or body mass index greater than 30 kilograms per meter squared. So, if we want to move on to the next slide.
Backtrack one slide. So it's kind of interesting is that what is the best body mass index? It turns out it's somewhere between 20 to 25. It's probably 23. Now, very few people have a body mass index of 23 anymore. And again, what you're going to hear about is that if your body mass index gets higher than 23, your risk of being in the hospital or dying from COVID goes up starting at 23. So I'm 24 right now, and I struggle with my last 5 pounds. I will struggle for the rest of my life, but I'm really working harder at it. And what we're going to learn about is COVID is just a reflection, and it's an amplifier what's going to happen to you in the future. So one of the things, you have blood pressure, diabetes, congestive heart failure, atrial fibrillation, you smoke, you're overweight, your kidneys don't work. It means your life is ending sooner than you want it to be. And one message here is that, do you have blocked arteries? Yeah, you do. We know that an average Canadian, the age of 20, already has blocked arteries. We know that from autopsy studies. We know from Spanish work that in your 30s, over 2/3 of people already have some degree of blockage formation, and you can predict that, and one of them is your body weight. Having high blood pressure means your arteries are damaged. It's not normal to have a blood pressure over 110 to 120. We got used to saying, oh, it's okay. Well, if it's okay to have damaged vessels, good for you. So what I'm going to try to do is, I'm not saying you should be on medication to lower your blood pressure. What I'm saying is that having high blood pressure can be the first sign of damaged vessels, atherosclerosis, and take it seriously and do something about it. I'll be quiet for a little bit.
So, adding on to that, considering excessive weight is gained by consuming an excess of calories in comparison to calories utilized by the body, with the excess being stored as fat tissue, there's a clear correlation to diet as well. So diets with high amounts of fat can result in excessive and abnormally higher levels of cholesterol in the blood. Depending on the balance between the fractions of saturated and unsaturated fatty acids, fat contained in the blood circulation can lead to the formation of atherosclerosis as well. Diets extremely rich in carbohydrates can also lead to increases in other lipid components of blood, such as triglycerides, which can also lead to the formation of atherosclerosis as well. And these changes are further built on by obesity-related elements of metabolic syndrome, such as insulin resistance and glucose intolerance, which further compound this problem. The excess fluid in your bloodstream that arises due to the obesity-related elements of metabolic syndrome, alongside the narrowing of your arteries from atherosclerosis, means that your heart must work harder to pump blood and oxygen around your body. There will be an increase in your blood pressure as a result. Over time, this can add stress to your heart and blood vessels and lead to not only hypertension, but also other cardiac problems as well. So how can you manage this? Getting regular physical activity helps your heart and blood vessels stay strong and healthy, which may help lower your blood pressure. It also works toward increasing your daily energy expenditure. Moreover, due to the close connection to diet, working to reduce not only caloric intake so that you're in caloric deficit, meaning that you are losing weight now, can also prove to be useful. In addition, monitoring the various macronutrients can also help to obtain a healthier weight and lower your blood pressure overall. So if you want to move on to the next slide.
That's kind of wonderful. One of the things is that weight is a challenge. 90% of us will develop hypertension, and I was thinking about 90% of us are probably in excess of weight. Now, it's kind of too easy to say it's just an imbalance between energy and supply. That's the easy solution. But I'm also struck is how your brain works too as well. In some of the thinking processes, there could be some neurohormonal imbalances in people who tend to gain more weight. So I've used medication personally myself to help control my weight, and I find that to be helpful. It helps decrease some of the cravings. But I also don't know how much my cravings and my desire to eat is a behavior change, and how much of it is a chemical change or a combination of all the above. All I can say is that there are many options available to you, and Mira and Devanshi have actually led a great group of our weight loss crew on Tuesdays, and they helped me so much with weight reduction. And Jerry and his crew with meditation, mindfulness, and exercise has helped me as well. So these are pillars of good health. You mentioned things like sleep. I don't know about sleep. That's one of my deficiencies. But activity, proper dieting, and using the best of science is important right now. So there is tremendous amount of hope about how to manage these things better and better. So thank you for sharing that. Next slide, please.
So in addition to monitoring your calories and macronutrient consumption, there are certain nutrients that can aid in managing your susceptibility to develop hypertension as well. So the DASH diet specifically aims to achieve this, as it calls for 4 to 5 servings of fruit, 4 to 5 servings of vegetables, and 2 to 3 servings of low-fat dairy in order to help achieve this. Its overall goal is to decrease sodium intake and increase potassium, calcium, and magnesium. So too much sodium, which is an element in table salt, increases your blood pressure. And this is due to the kidney's inability to regulate fluid, as excess sodium is reabsorbed by your kidney into your bloodstream. And this causes for excess water to also be reabsorbed into your bloodstream. And this increase in fluid volume resultantly will increase your blood pressure. So what are some changes that you can make to decrease your salt intake? In order to eat a low-sodium diet, the American Heart Association recommends no more than 1,500 milligrams per day for most adults, especially if you're at risk. So when you're at the grocery store, try to opt to buy more fresh, frozen, or canned vegetables that have no salt or sauce added. So on the other hand, though, not eating enough potassium, which is a mineral that your body needs to work properly, can also increase blood pressure and lead to hypertension. Potassium is found in many foods such as bananas, potatoes, beans, and yogurt. And in a day, the recommended potassium intake for the average adult is around 4,700 milligrams. However, this should be taken with precaution. Potassium can be harmful in patients with kidney disease or those who take certain medications, and so the decision of whether to take excess potassium should be discussed with your doctor beforehand.
This is actually a fantastic diet. If you can just backtrack one more time. So there are many good healthy diets, but if you want to lower blood pressure, dietary approach to stopping hypertension, or DASH, is a very, very effective diet. It's been proven to lower blood pressure. And as you mentioned, thank you for sharing that, it's a combination. So you replace salt with potassium. Where's potassium? Fruits and vegetables. Avoid the processed foods. It's kind of simple in one sense. And then we think high dairy can make a difference. And there's a debate where that dairy should come from right now, but having more calcium actually from non-dairy sources are also important too as well. So I love this diet. It can help me lose weight. It can help control blood pressure, but this is one of many other diets. So my encouragement to you is explore this diet if you want to lower your blood pressure. Next slide, please.
Yeah, so moving on, a bit different from diet. So factors such as tobacco and alcohol consumption also play a big role in increasing the risk for hypertension. So starting with tobacco, smoking increases the risk of developing hypertension because substances like nicotine contained within those products will cause a constriction and narrowing of the vessels over time. And so over time, the vessels become stiff and less elastic, and this results in a rise in blood pressure. And so in order to counter this, actions of reducing how much one smokes to completely eliminating the smoking will effectively decrease the risk of developing hypertension. The same.
Go back one slide again. So basically, this is probably this really tough thing to do, but you have to be a millionaire because if you take the money that you pay in tobacco and invest that wisely, you're a millionaire, okay, after 30, 40 years. That's if you buy legal cigarettes. The other interesting thing is that every time you smoke, 5 minutes of life will be lost. I'll repeat that. For every cigarette, 5 years of life or 5 minutes of life will be gone because there are 7,000 substances in tobacco that are unhealthy for you. I know it's hard, but guess what? You can do it. If we can help, we'll be glad to. There are combinations of diet, lifestyle changes, medications. And we have a whole crew of people out there to help you too as well. So if you want to get healthier and you want some help, be glad to. There's a lot of, Cancer Society, Heart and Stroke, a lot of good 1-800 numbers out there too as well. So please think about this. And if you really love somebody in their Christmas stocking or their birthday, give them some Nicorette patches or gums just to get started.
Yeah, so the same goes for alcohol. Consumption of it stimulates the release of a vasoconstricting peptide hormone called angiotensin, as well as acting on a number of other biological systems, which are shown on the slide. And ultimately, what it does is it leads to the constriction of blood vessels, which causes hypertension. And so the options in treating alcohol-induced hypertension can be divided into both physical and pharmacological. So first, to look at physical, you can reduce the amount of alcohol consumption, as well as increase physical exercise, because that would help upregulate the generation of a molecule in the body called nitric oxide, which helps regulate your blood pressure. And pharmacologically, it is possible to take medications that are angiotensin receptor inhibitors or angiotensin converting enzyme inhibitors. And what they do is they will block the pathway in which they will block different pathways, and it'll cause the body to induce, and it will block the different pathways in which the body induces vasoconstriction.
It's kind of interesting if you go back to alcohol and smoking. When my mother was pregnant with myself and my brother, the doctor said, just have a cigarette to calm your nerves. And then we said that, so we knew that was wrong. We learned later. Then we found out that alcohol wasn't good for pregnant women. Now we know that alcohol is a type 1 carcinogen. That means it's in the same category as cyanide, cyanide, tobacco. These are direct cancer promoting areas. And the other thing too is processed meat is a type 1 carcinogen too as well. So it's sad how that's changed, but that's what the science has said. Now, can you drink alcohol or not safely? The answer is, I think, having 2 to 3 or 4 drinks per week for an individual, a little bit of bad stuff put into that is, you can certainly probably do that. But there is no safe level of alcohol. It is carcinogenic. It does a lot of bad things right now. And some people who have atrial fibrillation, I personally would try to avoid that. And do I have a drinking problem or not? Is that the best answer is that if you get annoyed when someone mentions the word alcohol, you have a drinking problem. Is that denial is a great defense mechanism, and basically is that most people see the concern before you do as the individual with this problem. So think about this. Now, it doesn't mean you have to avoid everything. I mean, I do a lot of bad things in this world, but one of the things I try to do more good things. And unfortunately, alcohol is now on bad list right now. So now, am I perfect? No. We'll have a drink every once in a while. Yes. But it's not a health food.
The next risk factor that we'll explore is stress. So, stress is defined as the feeling of being overwhelmed or unable to cope with mental or emotional pressure. So, in our everyday life, we face a number of different stressful situations, whether that's at work or at home. And so, when placed in these stressful situations, the hormone cortisol increases and causes a temporary increase in blood pressure as the blood vessels narrow. However, stressful situations alone are not likely to increase one's risk of developing hypertension, but rather habits that come along with being stressed. For example, prolonged stress can cause or can lead to the use of alcohol and tobacco, as well as the excess consumption of unhealthy foods, which are high in saturated fat. This will eventually lead to weight gain, and those are factors that we've already discussed with relation to hypertension. So, as it's evident, alcohol, tobacco, and diet then becomes what ultimately increases one's risk of developing hypertension. Now, to counter these effects, you can try to avoid being in stressful situations by regularly taking time to relax, exercise, and meditate. Hence, when these stress factors are eliminated, then your blood pressure will return back to normal. And lastly, the last set of factors that we'll talk about are being diagnosed with other conditions as well as taking other medications and how they increase the risk of hypertension. So the common condition that confound with hypertension are diabetes, kidney disease, hormone problems, and more of what's listed here. So for example, hypertension is twice likely to develop in patients with diabetes than those without. And as for medication, such as acetaminophen, immunosuppressants, and many more listed here, the chemicals act through different pathways to induce the narrowing and stiffening of the blood vessel. And so if you take these medications for a really long time, so long-term prescription, then you will likely be at higher risk for developing hypertension. And so to sum everything up, both non-modifiable and modifiable factors play a big role in increasing the risk of hypertension. And so in order to manage and decrease the risk, it would require individuals to make lifestyle changes. So whether that's changing your diet in order to manage your weight or minimizing stress to control alcohol and tobacco consumption. So it could be a really difficult process. And so you can reach out for support with any questions you have, as well as check out Dr. Kernu's YouTube channel for more resources. And so that's on the risk factors for hypertension.
Thank you. It's like the Toronto Maple Leafs. You keep getting better, and you can get better. So you can take unhealthy. Last year, the Toronto improved their defense. Next year, they're going to improve their goalies. They're going to have your core group of players. So your core group is better background. You know what your blood pressure is. You're looking after yourself. You're going to try to spend an hour of activity. You're going to manage your stress differently, and so you don't have to rely on your friends to tobacco and the alcohol to calm your nerves. There's much better ways of doing this. You can thank you for sharing that wonderful overview. Thank you so much. We have choices.
Next slide, please. So I know that we're all probably exhausted from hearing about COVID-19 and suffering a bit from pandemic fatigue. However, while we're all getting vaccinated, there's still much to be understood about COVID-19 and the vaccine. As a result, we should still try our best to minimize the potential of getting the virus in the first place or having it be really bad if we do get it. I mean, better safe than sorry. So COVID-19 has many risk factors, and research is being pumped out each and every day with new information to contest or improve current theories. As of right now, risk factors of COVID-19 stem from three main categories, that being age, weight, and medical health conditions. In regard to age, adults over 65 have an increased risk of death and severe illness from COVID-19. More than 80% of COVID-19 deaths occur in people over age 65, and more than 95% of COVID-19 deaths occur in people older than 45. This can be attributed to age-related epigenetic status as a result of genetic, lifestyle, and pathogenic factors. The dysfunction of the aging immune system results from two phenomena. immunosenescence, in which there is a decline in immune function because of interference with pathogen recognition, alert signaling, and clearance, as well as inflammaging, in which there is a systemic increase in chronic inflammation due to an overactive and ineffective alert system. Furthermore, weight plays a huge role in how your body responds to the virus as well. A meta-analysis from Obesity Reviews pulled data from peer-reviewed papers featuring 399,000 patients found that obese people were 113% more likely than people of healthy weight to land in the hospital, 74% more likely to be admitted to an ICU, and 48% more likely to die. This stems from impaired immunity, chronic inflammation, and blood that's prone to clot as a result of obesity. Moreover, people who are obese tend to have comorbidities such as heart disease, lung disease, and diabetes. This results in increased inflammation due to high blood sugar levels, fat, and blood pressure. Upon infection, the virus injures endothelial cells, activating the coagulation system and resulting in your blood to be thicker and more prone to blood clotting issues. In addition, fat cells infiltrate the organs where immune cells are produced and stored, causing the body to lose immune tissue in exchange for adipose tissue, the tissue that stores fat. Furthermore, abdominal fat tissue pushes up on the diaphragm, impinging on the lungs and restricting airflow, worsening the effects and degree of SARS-CoV-2. In addition, various medical health conditions can affect one's risk of COVID-19 morbidity. Cancer, diabetes, heart conditions, and hypertension can greatly affect how your body responds to the virus. For example, the increased risk from cancer stems from a compromised immune system as a result of various types of cancer treatment therapy such as radiation, chemotherapy, radiation surgery, stem cell, or bone marrow transplants. Diabetes, either type 1 or type 2, leads to an increased risk of fatal consequences upon infection. Research suggests this is due to fluctuations in blood glucose levels and possibly the presence of diabetes complications. Diabetes itself leads to a compromised immune system due to low and chronic inflammation. The inflammation damages the pancreatic beta cells and leads to insufficient insulin production, which results in hyperglycemia. Hyperglycemia in diabetes is thought to cause dysfunction of the immune response, which fails to control the spread of invading pathogens in diabetic subjects. Furthermore, the International Diabetes Foundation also suggests that elevated blood glucose levels may provide a thriving environment for the virus as well. Furthermore, heart conditions such as heart failure, coronary artery disease, cardiomyopathies, and hypertension also increase one's risk of COVID-19. People with pre-existing heart conditions are particularly vulnerable and face a higher risk of dying from COVID-19. Emerging data shows that people with heart conditions are 4 times more likely to die from the virus than patients with no underlying conditions. The Heart and Stroke Foundation also states that more than 1 in 3 COVID-19 patients had several underlying conditions, including high blood pressure, coronary heart disease, and cardiomyopathy. People with high blood pressure are nearly 2.5 times the higher chances of dying if they contract COVID-19 compared to those with no underlying conditions. The mortality rate among patients who suffer a cardiac injury while in hospital for COVID-19 is 51%, so 1 in 2 people.
So now we're going to talk a little bit about COVID-19 and how the protocols we've been subjected to during COVID might be related to hypertension. So there's no denying the fact that the quarantine and periods of lockdown and social isolation have definitely changed our lifestyles. We've had to adjust to a new normal. And one thing that might have come out of this is the increased incidence of hypertension and poor hypertension management. So there was a study that was done in Argentina where they basically looked at 12,241 patients. They looked at patients who came into the ER during the 3 months of isolation and lockdown in Argentina, the 3 months before this lockdown was initiated, and then the same 3 months of the lockdown in the year prior, so in 2019. And they looked at the incidence of high blood pressure in these patients who were being admitted to the emergency room. So in the 3 months in 2019, they found a 17% incidence in high blood pressure in these patients, 15% the 3 months before the lockdown was initiated, and during the lockdown, it was 24%. So after accounting for a bunch of confounding variables, things like age, gender, and time of month, stresses in life, things like that, they found an overall 37% increase in the odds of high blood pressure upon admission to the ER during the pandemic. And the researchers at this study kind of speculate that this might be indicating a trend that there could potentially be more poor hypertension management during periods of lockdown and isolation. And it might even lead to the incidence of hypertension in different individuals based on things like lifestyle choices. So before I go to the next, or I guess we're on the next slide, before we kind of dive into why that might be, I just wanted to pose a question to the group. What do you guys think might be some reasons why we might be seeing an increased incidence of hypertension during periods of lockdown and isolation? So just feel free to chime in with any ideas.
Well, in Ontario, alcohol consumption is up by 30 to 40%. People are eating a lot of fast food. People aren't exercising. They're feeling stressed. They're gaining weight. I can think of a lot of reasons.
Yeah, there's definitely way more than one, and you hit the nail on the head on a bunch of them that are contributing. Does anyone else want to add anything before we move on?
I think Dr. Kearney said all of them, but definitely lockdown is more stressful.
Yeah, for sure. Okay, we can move on to the next slide and we'll just unpack some of these reasons a little bit more. So the researchers of that Argentinian study, plus a couple of doctors that were polled by different associations, have kind of come to this idea that it's basically 3 different factors that are kind of contributing to a potential in poor hypertension management or the incidence of hypertension. So the first kind of sphere of all of these factors is behavior. So definitely there have been changes in our behavior. There's been a decrease in the step count as we've become more sedentary. You're no longer walking from place to place. You might just be sitting at your desk all day due to things like work from home or online school. There's also an increase in food consumption. So just by being at home more often, sometimes when those cravings hit, you have more easy accessibility to food, which might prompt you to eat a little more than you normally would. And then the other sphere of stuff is stress. So lockdown, COVID-19, the pandemic, everything has been really stressful. So there's obviously an increase in acute stress that can be brought on by so many different things, worrying about your health, the health of a loved one, financial strains, changes in employment. All of those things can cause a lot of stress. There's also an increase in smoking and alcohol consumption. This is actually something I heard on the radio yesterday while I was driving home. Despite the fact that we've had several stay-at-home orders, there's actually been an increase in driving under the influence or impaired driving charges in Ontario during lockdown. And they speculate that this is kind of correlated to about a 25 to 30% increase in both cannabis and alcohol consumption. So some people have increased their consumption just by, being at home, or a lot of times it could be also a response to stress. So the way you respond to stress can also affect your overall health. There's also things like stress eating and lack of sleep that have been associated with potential increase in hypertension. And then the final sphere is just go back to the slide. This final sphere is kind of care. So there might be less in follow-up care. Our healthcare system is kind of transitioned online, and sometimes that can be a little hard to get used to. Also less access to resources. So as Dr. Kearney mentioned before, taking your blood pressure at the pharmacy or trying to check your weight at the doctor's office, at the gym, or something like that wasn't ideal before COVID. But during these periods of lockdown, it's really stressed that you can't be reliant on those external sources for monitoring your health. So always a good idea to have those machines and tools available so that you're able to keep track of your health. And finally, there might have also been a decrease in medication compliance. Some physicians have noted that in their practices, like a lack of support or misconceptions about certain hypertension medications led to a lack of medication compliance in some of their patients during periods of isolation. So what this essentially boils down to is that you're gaining more weight, you're decreasing your physical activity, and there's a lack of active hypertension management or being proactive in your health. So this entire experience with the pandemic has really called on us to be a lot more proactive in our health and take a lot more charge on how we choose to structure our lifestyle and our behaviors, especially during these tough times. And just one more statistic before we move on to the supports. So this is a US-based study, but it basically indicated that there was between a 36.3 to a 59.6 increase in food consumption, and that was alongside a 67.4 decrease in physical activity. So you're really seeing that increase in food consumption corresponding with that decrease in physical activity, which usually leads to weight gain and reduced exercise tolerance, things like that are kind of risk factors and catalysts for developing hypertension.
It's interesting that COVID is led. You can keep the slide over here. Is that it led us to no? Go to the next slide. It led us to do things differently. So I'll never forget when Paul and Stuart and others said, let's do something about these webinars. So if it wasn't for COVID, we wouldn't have had these webinars. If it wasn't for COVID, we wouldn't have known how good vaccines are. If it wasn't for COVID, I wouldn't know how good the people around me are and how special they are. If it wasn't for COVID, I wouldn't have learned so much because I now have access to so much more information. While I want COVID to be over, I also appreciate is that this has been a year or two of tremendous growth. I think I'm a better doctor because of COVID. I've had the honor to serve in a COVID unit, and it's interesting when you saw those slides that the first time around, the first wave of COVID killed, unfortunately, older individuals. But this wave, the new variants are killing younger people and making them sick. So I've seen a number of 30-year-olds that have been fighting for their lives that shouldn't be in the intensive care unit. Well, the overall mortality of COVID is probably less than 2%. It's been a deadly disease and causing havoc to the world. So I learned to control my behaviors better. And I really want to thank you, my patients, for allowing us to serve. For those out there, those frontline workers that have done tremendous work, and take a look at the video that Stuart and the team put on last week about thanking healthcare workers. So, as was said, you can either hide and run or rise and get better. And I like to think that we can all get better now. So tell us a little bit about the slide here.
Yes, so these are just some supports for managing hypertension and your risk factors during the pandemic. The first step is kind of empowering yourself with knowledge and kind of learning more about hypertension, other cardiovascular risk factors, so that you kind of have this good base of good knowledge to be able to make the changes that you need to in your life. Maybe that's getting back on track if you might have deviated from the course during the pandemic, or maybe it's just supporting you in the changes that you've already made. So the first thing I can recommend checking out is our webinar and video series. There's a ton of them on YouTube. Yes, some of them are long, but they are definitely worth the watch. There's so much information and so much wonderful knowledge that's being shared. So I highly recommend checking out some of our videos. I've highlighted a couple here. So we obviously have our hypertension videos. So things like what is hypertension, managing your risk factors, managing high blood pressure. There's also videos on using technology to optimize your healthcare, definitely relevant in this kind of virtual age. So definitely check that out. There's a range of videos and a variety of different topics, and you can kind of pick and see what you're interested in and learn a little something. And if you're more interested on working in smaller groups or with groups of people, perhaps working one-on-one with someone for support, we do have a lot of great groups at the clinic as well. So things like Technology Club to help you get situated and help you get started on using all of these different online resources. There's the wonderful Weight Management Club or Weight Loss Club. That's really great if you're kind of struggling to lose weight or looking for a little more support in that change in your life. There's Smoking Cessation, the Great Motivation, Mindfulness, and Moving Club, really great for helping you manage stress, but also getting moving. There's also the Sugar Club that is more focused on diabetes, something really great if you're struggling with diabetes as well. There's also the Cooking Club, which is more about like healthy eating and healthy cooking. So depending on what you might need support with, you can sign up for any of these groups, multiple of these groups if you would like, and we are more than happy to help you out as you make these steps and changes.
So I want to give a special thanks to Dee Dee. She really has led this cooking club and different things. My wife hates the either the first or second Sunday of every month between 4 and 6. We limit to 2 hours. As we can't go on vacation anymore, we have a virtual vacation. So we're going to Africa this Sunday. We're going to learn how to use grains and whole foods again. We had a little preview yesterday. Dee Dee cooked some quinoa there with some leftovers and went downstairs and got some other things, and it was gone within 10 minutes. And I want to thank her for being so helpful and such a great cook and sharing that. And I also thank everybody else too as well. It's just one, and Steffi is also the cooking club is joining forces. So we have a big crew, and so we have about 30 people that are potentially signed up. So we cook from 4 to 6. We have a blast. And usually Dr. Ganguly's there, and we argue about certain things, and I learn how to sharpen blades and how to do a proper cut. And we can debate whether or not this you should have dairy products or eat eggs or should be a DASH diet. So it's really wonderful. We always cook something, and great discussions. And each one of these clubs are special places, and I feel bad that more people don't take advantage of what is offered. And so the pandemic has made us closer and stronger. And I feel very grateful for all the hard work of so many, and take advantage of these young people. They've made me better, and they'll make you better too as well.
And thank you for that, Dr. Kearney. Really highlights the importance of taking advantage of some of these resources. A couple of other things you can look at. So the British Heart Foundation has a lot of really great videos on YouTube that are like exercise programs that are more geared at cardiac rehabilitation. So if you have limitations in the amount of activity you're able to do, potentially other conditions, other comorbidities, or maybe you're having difficulty with your hips, your knees, things like that, I highly recommend checking them out. Usually between like 50 minutes to an hour is the length of most of their videos. They offer seated and standing programs going up from I think level 1 to around level 5. So if you're not ready to get into like a more intense exercise program, or you find that some of the at-home fitness videos you're finding online or on YouTube are a little too intense for you, this is a great starting place to kind of get more movement into your day. There's also Dr. Kearney's book, 30 Days to a Healthier You. So that's $30. The money goes to charity or to a cause that we kind of agree on at the clinic. So another great resource to start off with if you're not sure where you should be starting in making positive changes. And next, if you're looking for information, a great starting place is the American Heart Association and Hypertension Canada web pages. There's a lot of really great information there. If you're ever concerned or have a question about something, and you can always ask us at the clinic, but you could also check out these web pages and you can find really good, credible information. And finally, there's also a bunch of at-home fitness videos. One of the things that's kind of boomed during lockdown is a lot of fitness culture online. So take advantage of that. You can look at beginner videos, there's intermediate videos, advanced videos. So if you're trying to step up your daily activity, you can look to any of these resources to kind of help you get there. And they can also help support you in making healthy diet and lifestyle changes as well. So a couple of key takeaways for this section. Lockdown and isolation during the pandemic has 100% altered our lifestyles. We have become, in general, more sedentary, less active, and we're under more stress. So all of these changes have been associated with an increased risk of hypertension, and the decisions we make in response to all of these changes has an impact on our health. And there are plenty of resources at the clinic and online to help you get back on track and support you in managing your health during these times.
Okay, so we're going to dive into the comorbidities in just a bit more detail. So a study done by Stats Canada has shown that a series of common medical conditions and comorbidities are associated with a severe course of COVID-19 resulting in death. So the main findings showed that dementia and Alzheimer's, as well as lung-related diseases, played a large role, as can be seen by those large bars. We will primarily be focusing on the impacts of hypertensive disease, obesity, and diabetes, which all play a role in a more severe course of COVID-19. Moving on, we have a second study done in the United States where they looked at 36 million active patients. Nearly 10 million of these patients have documented hypertension, diabetes, chronic obstructive pulmonary disorder, or moderate to severe asthma as of April 30th, 2020. This diagram shows that with increasing age, as you go down the diagram, these comorbidities can become even more serious, as can be seen by the greater number of deaths on the right side and higher percentages shown in the bars. Next slide. So during the current pandemic, it is believed that obesity rates are increasing all over the world. According to a survey done by the American Psychological Association in February 2021, since the pandemic started, 42% of the American population reported they gained more weight than they intended. Of this 42%, they gained an average of 29 pounds, and 10% of these said they gained more than 50 pounds. Drastic increases in weight come with significant health risks, including higher vulnerability to serious illness from the coronavirus. And this has kind of already been touched upon by a few of the other members of the group during this webinar. So why might people have been eating more and putting on this weight? To combat the COVID-19 pandemic, governments have imposed social interventions such as lockdowns. Although the goal of these lockdowns was to isolate people all over the world, there has been an unintended consequence. There's been an economic crisis as many businesses have gone bankrupt and unemployment rates have increased. The existence of a global pandemic can create psychological stress, but feelings of anxiety might be increased by a worsening of socioeconomic conditions. Also, physical distancing and isolation might remove meaningful social interaction and increase feelings of loneliness. As such, the COVID-19 pandemic offers a perfect storm for inducing psychosocial insecurity. With increased socioeconomic hardship and deteriorating psychosocial health, it can have a negative effect on food-related behavior and an increase in chronic stress. An abundance of highly processed, energy-rich, cheap, and readily available foods promotes calorie intake beyond energetic needs, and such foods are often preferred by individuals with a lower socioeconomic status who have limited income and resources. Many of these foods are high in saturated fat, sodium, and sugar, and even though those that may be of higher socioeconomic status are having difficulty finding fresh foods, they are therefore settling now for the ready-to-eat meals, and those, again, are high in saturated fat, sodium, and sugar. Psychosocial stress reactions have been found to also increase energy intake. Home confinement during the COVID-19 pandemic provides an altered food cue exposure. This essentially means that people have more access to food. So if you're at home, you're more likely to kind of go to your cupboards versus if you're out, you may not have that immediate access to food. This challenges the individual's cognitive restraint and enhances impulsive eating behavior. Also, emotional eating, often used to relieve negative feelings, might increase under these circumstances. The elimination of social eating practices could encourage a reduction in mindful eating, which might negatively influence dietary choices and promote overeating. And just the last point I want to mention, which has already been mentioned, the closing of fitness centers and stopping of organized sports in combination with the need for physical distancing could make maintaining an active lifestyle difficult for individuals of all late ages. And again, that's that sedentary lifestyle. So the major comorbidities which seem to increase the risk of experiencing adverse effects and unwanted outcomes from COVID-19 are obesity and diabetes, along with hypertension. These concepts are all very closely related. Obesity itself can be the cause of both diabetes and hypertension, so it's not surprising to find someone who suffers from these conditions together. Each of these conditions results in unwanted harmful effects on people's bodies and proper functioning, which in turn leaves them more susceptible to increased sickness from diseases such as COVID-19. So we're just going to touch on the connection here between obesity and diabetes. It could be complex, but generally can be simplified for our understanding today. So as obesity, as you can see from the chart, can lead to many respiratory issues, other comorbidities such as diabetes and metabolic risks, including hypertension and insulin resistance. Now, to focus on the connection between obesity and diabetes, obesity can lead to increased levels of free fatty acids and inflammation. Through complex mechanisms and interactions in the body, this leads to increased insulin sensitivity. If you guys don't know, insulin is the chemical messenger that tells your body to lower blood glucose levels. So resistance to it results in increased blood glucose levels and thus the development of type 2 diabetes.
Hi, everyone. So to continue, but this time with obesity and hypertension. So the connection between obesity and hypertension is also very complex and involves many different mechanisms, pathways, and other physiological changes. Now, these changes are seen at different hormonal, chemical, and functional levels, and they ultimately result in changes by which your body maintains fluids and sodium levels. And as a result, this leads to an increase in blood pressure. Next slide, please. So the connection between these three comorbidities, obesity, diabetes, and hypertension, was shown in a 2018 study by Statistics Canada, which revealed that 13.4% of obese individuals had type 2 diabetes, and in comparison, that's 2.9% in non-obese individuals. Also, 29.5% of obese adults also have high blood pressure in comparison to 9.5% in non-obese adults, And additionally, 26.8% of Canadian adults are classified as obese. So from what we could just tell from the studies that there is an obvious correlation between the incidence of these three comorbidities, that is hypertension, diabetes, and obesity. Now, how exactly do all these three, and specifically obesity and diabetes, affect your body's ability to combat COVID-19? Well, as was brought up before, essentially, obesity itself could lead to a weakened immune system, which could be due to an increase in immune cells that cause inflammation, which puts your body in a state of chronic inflammation and contributes to insulin resistance. Both of these are detrimental to your health and obviously impair with the body's ability to efficiently and effectively deal with a virus, bacteria, or any other harmful thing that might enter your body. Now, in terms of diabetes specifically, increased sugar levels, also known as hyperglycemia, can affect the body's immune responses to viruses and bacteria. And research has shown that those with high blood sugar levels experience delayed viral clearance, and specifically that is just the removal of a virus from one's body. So essentially means that your body is going to take longer, or your immune system is going to take longer to fight off and get rid of the virus. Next slide, please. So does research actually confirm this, that, your obesity and diabetes weaken your immune system? Well, yeah, research into COVID-19 show that those people with comorbidities will increase more severe outcomes of COVID-19. Now, although data into COVID-19 is still in the early stages because COVID-19 is still relatively new, current data does support the idea that obesity increases the risk of adverse reactions to COVID-19. Specifically, one study using data from New York City found that 41.7% of individuals hospitalized for COVID-19 were obese. And generally speaking, higher BMIs were correlated with more severe symptoms and more critical conditions. Additionally, data collected from many reports also determined that there is a 66% increase in need for ventilation in obese individuals in comparison to non-obese individuals. And now looking specifically at diabetes, a meta-analysis of 9 studies, and again, somebody discussed what meta-analysis was, as like looking at and evaluating data from several different studies, found strong correlations between COVID-19 severity and diabetes, as well as increased fatality rate of 7.3% versus 2.3% in patients without diabetes. And ultimately, it can just be seen from what we just brought up and all the research that has gone into this, is that comorbidities such as obesity, hypertension, and diabetes all play a role in increasing the severity of COVID-19. And these conditions often occur together, which increases the risk of adverse reactions to COVID-19 even more. And that's why it's really important to emphasize and promote healthy eating and living habits, since our lifestyles can have such drastic effects on our well-being. I'd also recommend checking out, as like previously stated, some other initiative Dr. Kearney's clinic offers, such as the Sugar Club, Motivation, Mindfulness, and Moving Club, Weight Management Club, and Cooking Clubs for information and resources on living and managing diabetes and obesity, as well as other videos on the YouTube channel. And yeah, so that was our section on comorbidities. I'd just like to ask if anybody wants to add any of their thoughts or opinions.
I think what you guys have showed so elegantly, everything's connected. From my emotional health to my physical health. And what got me thinking about today, it's COVID. Tomorrow, your COVID could be having a stroke, could be having cancer, losing job, breaking a hip, on and on and on, developing dementia. So COVID is just one example of how your equilibrium is broken. And this is a big one, but you can see that having better resilience and learning to get better is so important. So I'll never forget, is one of the strongest predictors of longevity is quality relationships. So think about how to nurture those, how to make that better, and how to control what you can control, and the things that you can't control, try to leave that aside. Some moments I can do that, other moments I cannot. And I think you've shown me, and I think the pandemic is probably being hardest on younger individuals. You should be in your 20s enjoying the world and searching the world. Whereas we get older, we tend to maybe not do as much as you guys do and explore as much. So I've explored the world a lot more this year in a different way. And thank you for sharing all those insights. Just remember how everything's connected. And how you can actually be part of a better solution for yourself and for others. Thank you for sharing that. Any thoughts from anybody else at all? I'd be curious to see how people feel about this. Stuart, what do you think?
Yeah, for
I don't know. What do you think? You know, like how everything becomes connected, and how we learn, how we get better, or how we don't get better.
yeah, thinking specifically about hypertension, I know it's got the nickname the silent killer because many people don't take the liberty to measure their blood pressure regularly, and they don't feel any symptoms when it's happening. And that can affect many different organs. We've talked about that. There's heartbreaking truths when it comes to hypertension, but I think we've become desensitized to how important it is to manage your hypertension. We heard the statistic: 90% of people, as they grow up, will experience hypertension at some point, and the reality is it's important to know your numbers. It's important to know the causes. We've articulated that really elegantly with so many of our volunteers today who've done a fantastic job, especially talking about all these different comorbidities. But the reality is, I think you touched upon something that I think is really important, and we didn't emphasize too much in this webinar because we've talked about it before, is quality relationships. Harvard longevity study says that, having good genes is important, but the most important thing for living a long, healthy life and promoting a positive outcome in your life is experiencing joy, and that is through quality relationships. So staying connected, I know we've kind of been cut off in so many ways of being able to interact with people in person. This is one way we're trying to circumvent that, is meeting on a weekly basis. It's nice to see so many familiar faces each and every week. But if you don't join us for these webinars, it's important to recognize that there's other ways to stay connected as well. So for me, I think that we've all been sort of kind of severed and disconnected, and over time you kind of become accepting of that. And I think that's something that was largely attributing to the increase in alcohol consumption, the decrease in physical activity, the overeating, and all these things have adverse effects on your overall health, well-being. And once that ball starts rolling, sometimes it can be hard to stop it. So for me, I think that the pandemic has been really challenging for many people. We talk about the silver linings, but the reality is it's been really, really hard. So for me, I think just trying to stay connected, trying to stay healthy, and trying to not get too beaten down when you have the tough days, because everybody has those. I think that's sort of a lesson that I've learned, and I think that many people who I've talked to my age have also started to sort of become more accepting and appreciative of, especially in our early 20s when, as you said, a lot of us want to be out there living our lives, doing different things other than staying in the house all day.
Yeah, so I'd definitely like to add to that, like one thing is that definitely this pandemic got you to appreciate like the little things that we overlooked in the past, some things such as like just the times you have with your friends or your family and the relationships, which I hope when this is all said and done, we could all just uh, pay more attention to that, especially since, like Dr. Kern, you said, the relationships play such a big part in our health. And on top of that, maybe we could all now, after seeing so much health problems occur because of COVID, we could all start to care more about each other and look out for each other in terms of health. Maybe see somebody who's struggling with addiction, smoking, alcoholism, or they are not looking after themselves, just to kind of look out for them, check up on them, try to help, just because of, like we showed just now, like one health issue could lead to so many more. So yeah. But yeah, to continue now with to talk about some common myths that are associated with hypertension and specifically COVID-19 and hypertension. Something we've seen during this pandemic is a lot of common myths have been brought up, and we would just want to address these and debunk some myths in order to ensure the health and safety of a lot of people, especially in a time where misinformation is just very high. So this first myth here is that many individuals with hypertension essentially take medications to treat their condition, some of which were talked about here before today, such as ACE inhibitors or ARBs. And the mechanism through which these medications act has brought up the question if they possibly increase the risk of COVID-19. And if so, is it important to limit administration of these medications at this time? So to kind of understand what ACE inhibitors and ARBs do, they decrease blood pressure by inhibiting an enzyme known as angiotensin II. which is that eventually just leads to a pathway in which relaxes and dilates blood vessels and reduces blood pressure in the process. Now, in order to understand how these medications might increase the risk of contracting COVID-19 and the severity of COVID-19, we need to understand the mechanism by which COVID-19 enters the body. Now, without getting too technical, essentially just upon entry into the lungs, COVID-19 will bind to these specific proteins, specific receptors that are termed ACE2, and these mediate the uptake of the virus into the cells of the lungs. And it's essentially a concern that was brought up that ACE inhibitors and ARBs may increase the concentration of ACE2, which would increase the uptake of COVID-19 and subsequently the severity of COVID-19 if somebody was to catch COVID-19. But what does the research generally show? Now, in general, research done on this topic has shown that ACE inhibitors and ARBs actually do not increase the risk, increase the concentration of ACE2. And in fact, some studies even suggest that ACE2 concentrations are lowered. And studies go as far as suggesting that these medications actually decrease the risk of serious illness due to COVID-19. And it's been shown in patients taking these medications that they've experienced reduced rates of adverse reactions to COVID-19, as well as morbidity and mortality versus those patients who have not taken these medications. Now, one potential limitation with these studies is because COVID is relatively new, is that some of these studies have a smaller amount of participants. And nonetheless, though, with the current level of information and research done, scientists and doctors do conclude that ACE inhibitors and ARBs should continue to be administered, and it's advised and encouraged to try and keep your blood pressure lowered and to continue to use your prescribed medications as prescribed, and especially since uncontrolled blood pressure is dangerous itself, and to always just listen to your doctor.
So moving on to myth number 2. So it's a common misconception that individuals who suffer from hypertension are guaranteed to experience severe complications or death due to COVID-19. So if you have hypertension, then you will die from COVID. That's something that I've seen a lot circulating on social media and even in my family, in group chats and Facebook and things like that. So the truth is that hypertension can increase risks associated with COVID-19, including death and pneumonia, but it's not guaranteed. It's not 100%. Hypertension must be managed and treated to help reduce the risks associated with the virus. So like was mentioned before, treating hypertension comes in many different forms, including reducing sodium intake, following your doctor's recommendations and prescriptions, taking any prescribed medications regularly and as advised, for example, ACE inhibitors, measuring and tracking your blood pressure, living a healthy lifestyle, so diet and exercise, stress reduction, and avoiding medications that increase blood pressure. So all of the above management strategies or treatments for hypertension can help reduce the risks associated with COVID-19. The link between hypertension and COVID-19 is complex and actively being studied by researchers. Effective management of hypertension is the key to reducing complications if someone who has hypertension were to contract the virus. And a third myth in relation to hypertension and COVID-19 is that it's a misconception that the approved COVID-19 vaccines, so Pfizer, Moderna, AstraZeneca, and Johnson & Johnson, are dangerous for individuals suffering from hypertension and other cardiovascular health issues. So the truth is that these individuals may be at a higher risk for COVID-19 complications, but it is recommended that they do get vaccinated as soon as possible. The vaccine is definitely safe for people taking medications for various cardiovascular issues, including hypertension. So when testing the vaccines for safety and approval, many of the subjects were individuals aged 65 and older, as well as people with cardiovascular issues, such as hypertension. And no dangers were found after vaccine administration in these individuals. So overall, get vaccinated, make sure that you monitor your blood pressure and manage your blood pressure, and you can associate increased severity of COVID-19 with hypertension, but you can also reduce that risk. So the key takeaways from today's webinar is that decreased attention to one's health during the pandemic can increase the risk of hypertension. So make sure that you record your blood pressure, measure your blood pressure, and just be more aware of your physical and mental health. There are also supports at the clinic which can help you manage your health. So for example, Dr. Kearney's book, the webinars, and the different clubs such as Weight Management Club and Smoking Cessation Club. Also, lockdown and isolation during the pandemic has significantly altered our lifestyle. We've become more sedentary, increased stress, food consumption, and increased alcohol and smoking. This can increase the risk or exacerbate hypertension. In terms of comorbidities, the main takeaways is that obesity, hypertension, and diabetes are all serious conditions that increase the severity of COVID-19. So it's important to remember to look after your health and try your best to manage any and all illnesses you may have. In terms of myths, the main takeaway here is to keep taking your medications as instructed by your doctor and only make changes if your doctor tells you that it's necessary and safe to do so. In addition, hypertension can be managed to decrease risks associated with COVID-19, and it is not guaranteed that severe outcomes will arise if you contract the virus. It is also recommended to please receive the COVID-19 vaccine as soon as you are able to help protect both yourself and others. Next slide, please. So in conclusion, take care of yourself and manage your health carefully. It's important to seek support when needed. For example, through the clinic, which offers support such as webinars and different clubs, seek support from family, friends, and other loved ones. And in addition, hypertension and related health issues may increase the severity of COVID-19. So be aware of your health, manage and monitor your blood pressure, and take it seriously. Lastly, if you do suffer from hypertension, remember to take any necessary medications as prescribed by your doctor. And please, I cannot stress this enough, please get the COVID-19 vaccine to protect yourself and others.
All right, so thank you everyone for being with us for this webinar tonight. Maybe I'll hand it over to Dr. Kearney to say any last few words.
All right, get the next slide, please. One more slide. I want to just go. I just want to just go back and see Helen again. Put that slide, one more back that slide there. This is Helen. Helen came to the clinic today. She follows a rule of 90. Now 90 means a lot of things. So 90% of us will develop hypertension in our lifetime if we're not careful. The vaccines are 90% effective at decreasing hospitalization or deaths from COVID. I'm 90% healthier than I was before. I'm not sure I am 90% healthier, but I'm certainly healthier than I was before. And I'm really more grateful than ever for all the people around. And I think a special thanks to my staff who, when COVID started, we didn't stay locked down for very long. We were one of the first clinics to get back into working, and we still try to manage the in visits and the outpatient visits, and so if you need to come in, we'll find a way to bring you in as long as you feel you don't have symptoms of COVID. Sorry, just trying to get the light on. There we go. Let there be light. And so Helen also taught me is how to make everybody else better. She comes in, she smiles, she makes us better. At times I get angry at people. I don't mean to be angry. I'm just angry that people are for not trying to get healthier and things of that nature as well. So you point out is that I remember, you mentioned is because you have high blood pressure, you have diabetes, because you're overweight, because you're older, because you have renal insufficiency, because you smoke, doesn't mean you're going to get sick from COVID. I've seen some people I thought should get very sick who don't. On the other hand, I've seen some people that shouldn't get sick who get very sick as well. So it's, it's a part of it's the roll of the dice. You have to stock the odds in your favor. Look at the slide saying is that if your blood pressure on most days is over 140/90, you should be definitely on blood pressure medications if that's in the doctor's office. If at home, your blood pressure is higher than 135/85 on most days, you need to be on medications. And there's this 24-hour blood pressure machine that tells us that the blood pressure does fluctuate. A daytime wake blood pressure over 135/85 increases your risk. Blood pressure should be down to 120/70 or less at nighttime. So it's important to measure blood pressure multiple times like Helen's doing and keep a record of that. And so this is very powerful. For every 10 millimeters reduction in blood pressure, so for most of us, we can get 20 or 30 millimeters down. We can lower mortality for every 10 by about 10%. heart disease by 20%, congestive heart failure by 30%, stroke by 30%. Seeing too many strokes right now. And I know it's hard to do all the right things, but you know what? It's also kind of nice to be able to do that together. So I just want to thank everybody. This rule of 90 is that no guarantees in this world, but 90% of effort will give you 90% of benefit. So think about that. And I wish I had a vaccine for heart disease that was 90% effective at decreasing people from being in the hospital or dying from heart disease. Heart disease and cancer are still a leading cause of deaths. And blood pressure, your weight, what you choose can determine that as well. So many of these diseases are preventable. So first of all, I want to congratulate Emma for going to start her career in medicine, and you'll do a fantastic job. And for the others that they're going to start their careers in medicine, whether they choose, the fact that you're here trying to make a difference speaks volumes. Keep doing what you're doing. And if we all make the world a little bit better, then good things will happen. So I'm going to end here and open up to any questions or comments from anybody else. Stuart, any more questions or comments from anybody else?
Yeah, we did have a question. I wish I got to it earlier. It was from Dr. Hill and Dr. McGarry. I think they had to step out, but they had a good question talking about isolated systolic hypertension. Their question was, how aggressive should you be with the very elderly when it comes to isolated systolic hypertension in terms of medication management?
Yeah, so we know that 2/3 of the time is spent in diastole. So that's why initially we used to treat diastolic hypertension more importantly. But as we get older, our arteries become stiffer, and the systolic number goes up and the diastolic goes down. So systolic hypertension is actually much more deadly a disease process compared to both systolic and diastolic hypertension in older people. It means your arteries are already stiff. Remember that picture we show you of that plaque? Look at my skin, my wrinkle. Look at your guy's skin. You have beautiful skin. I have wrinkly skin. That means I have wrinkly arteries too as well. But I'm going to keep my arteries from stiffening up by exercise and weight reduction. So today I did the stairs and I played tennis last night, and I'll do it again tomorrow. I think we undervalue exercise as a prescription. My plea to everybody is to try to spend an hour of vigorous activity most days. Spend about 10 minutes or greater of just good relaxation, being grateful every day, and know your risk factors. So I would want my systolic blood pressure less than 140 on everybody, including systolic hypertension, the elderly, unless you're weak or dizzy, and you get dizzy when you get up. So if you're dizzy a lot, make sure as Emma pointed out, you measure your blood pressure while you're sitting then standing. And if that difference goes up tremendously, we have to temper our blood pressure management. But if you're a healthy individual, age is not a criteria for stopping blood pressure management. In fact, you want to treat more older people because you have more stroke and more heart disease and more kidney dysfunction. So I wouldn't treat any differently. I just can't be as aggressive as you can. So my goal for most people is to get to less than 130 systolic if I can. But that's and it depends how many pills you're taking, how many lifestyle changes you have to take. So and to build a good repertoire to that. So thank you for that question. So who should not have a blood pressure machine? Those who don't really want to, who don't mind having a stroke, heart attack, heart disease, kidney failure, dementia. Don't get a blood pressure machine. But if you want to make an intervention in that area, get one. And if you don't know how to use it, we'll show you how to use one. And one more thing, we're starting our blood pressure club, and if you need a blood pressure machine, need to learn how to use it, we'll show you how to do that. For those that want to purchase one, you make sure it's approved by Hypertension Canada. We still have a number left over for part of a research project. We've got a discounted rate that we'll share with you and give the same discount that we got. And we have a series of loaner blood pressure machines that if people want to take out a blood pressure machine for a month or so, we'll be glad to do that. And in fact, we can give you the batteries too as well to go with that. So I think that's all I have to say right now, but just thank you. Any other thoughts at all or questions for anybody else? Anybody else in the group want to say anything?
I'm just impressed, Doctor. Thank you very much.
Thank you for attending, and thank you for keeping yourself healthy. Thank you. Well, I'll give Stuart and Emma and the rest of the team the last word. I talk too much.
Well, first and foremost, I always like to start by thanking the team that put this all together. Obviously, we wouldn't have been able to spend 2 hours here together if we didn't have these volunteers working really, really hard to present some important information. So to all of our senior volunteers, to our new faces, who it's nice to see again for the first time since we interviewed you, and of course to Emma, our leader, congratulations on putting together a fantastic webinar. Truly, I appreciate it, and I know everybody else does as well, who were able to watch it both in this webinar, who were able to watch it on YouTube, or who are going to be watching it in the future. We have some, I want to open the floor if anyone wants to share anything, but my 2 cents is this. I think if you want your life to be sweet, you can't be bitter. The way I think about it is frustration is a wasted emotion. I get frustrated all the time, and I try to channel that as best I can, but the best way I think about it is when I play sports. When I played sports back in the day, if somebody hit me, for example, oh, my blood starts boiling, I'm frustrated, and the first thing I want to do is trash talk somebody, say a few curse words, things of that nature. But really, how am I helping my team in that way? I'm getting myself a penalty. It's a wasted emotion. When really, if I get a fire lit under me and I get motivated, I want to score a goal, I want to make a play, I want to help the team in the right way. So for me, I think that's a good analogy for life. You fall off the bull a million times, but I like to think of it as a mechanical bull. So if you fall off it, just put another token in and give it another ride. We're all going to fall down. I fall down all the time. Every single volunteer who spoke today has fallen down a million times in their life, but they're motivated to keep on going. And I know it's not easy, but that's the best way that I like to think about it, is that life gives you a million chances, and the reason why is because you're never going to get it on the first one. So that's my thoughts, and I just wanted to thank everyone for your time today, and I'll open the floor to any more final last words, and if not, we can always sign off and call it an evening.
So, Stuart, I think the Toronto Maple Leafs need you. And I noticed that we have Heather from Ireland there, so thank you for joining us. Any thoughts, Heather?
From England, but actually I'm in Canada now, so I'm local. But no, I just want to say, Stuart, that everything you said sounded so motivating. I thought that was beautiful. Thanks for sharing that.
Well, on behalf of all of us, thank you so much. I measured my blood pressure 4 times today. I got 4 different readings, averaging around 127 over 85. So, I hope everybody has a good blood pressure and a good day. And we will see you soon. And those who want to join us, we're cooking with Aditi on Sunday. So I'm really looking forward to that, and all the other different events we're doing as well. And thank you. Good night, and good blood pressure.
Good night, everyone. Thank you so much.